Good morning. So I'm very happy to be here today to participate in this very important symposium. And I would like to thank Dr. Felicia and Dr. Hannah for inviting me to participate. So I think there has been a lot of overlap on the data, but I don't think it's hurt too much to really put emphasis on the message of the two-day symposium, which is really how to address women cancers in the Latin America and the Caribbean. So what I'm going to do today is really to talk about the challenges and opportunities surrounding women cancers and service delivery. And I will talk briefly about my organization, our organization, Partners in Health, effort in addressing cancers in Haiti. And then I will close by a small personal story. So, looking, from the data that has been really presented here all morning, and looking at the magnitude of women cancers in Latin America and the Caribbean, and also the complexity surrounding access to care and treatment, there are lots of challenges which are structural and institutional, but also some opportunities. As it has been said, some of the structural challenges involve tardy diagnosis, health insurance coverage, high out-of-pocket expenditure, and that can also involve some hidden costs for transportation, for food, and we have also loss to follow up, discrimination. All these things really are structural challenges that affect women in mostly the rural communities to access care. I think I forgot how that works. Okay. So these are this was the slide on the structural challenges. Now, as per the institutional challenges, some of them are around limited resources, adequate infrastructure to deliver care in terms of equipment. Political commitment is one of the issues because it's related to funding allocation. And importantly, as it has been said this morning, availability of data in terms of information system in countries to register cancer care. So within our work, we think that there are two ways to address these gaps. The first one is mostly by decentralizing and strengthening services, in linking these services between communities to public health facilities at all levels. Because at the community level, through community health workers and a strong referral system, you can really transfer women, detect early breast cancer from the community to and send them to the health facilities at each level for primary care and secondary care. And in doing that, what will happen? You will improve access. Also, you will improve service delivery. And by doing that, you will have better health outcomes. And from this work of strengthening services at all levels, you will also improve quality and also community health at community level. The second way we were thinking about is innovative partnership for patient-centered care through better collaboration between services and health providers, but also advocacy, advocacy to build political commitment, mostly for policy development and also allocation of resources for services, but also for research. And as I said, PIH, our organization, has a long-standing history in health system strengthening in Haiti through our organization, Zami la Santé. Here is a slide which shows data collected in our hospital in Mirebalais from March 2013 to February 2016. And as you can see, even though it's in French, the first breast cancer is the first with a large number with women detected by our system in Mirebalais. The second is cervical cancer, as you can see in this slide. This slide also shows the volume of the pathology of services we provide at our hospital from 2011 when we opened, how the numbers has increased from 2011 to 2015. So, as you can say, our cancer program has been really expanded with the opening of the University Hospital in Mirebalais in 2012. And those initiatives include service delivery, patient support activities, but also community-based outreach. Here you have a slide of women that are receiving education on how to handle breast cancer issues. You see community education and big campaign. That slide, that picture on the back, it's really campaign that we are running to community health workers in the community, sensitizing women about early detection and use of services at our facilities. So I would like to really conclude by bringing a personal voice here. I know Felicia and Anna might not be happy with me today because it's not about the global agenda of cancer, it's mostly about the Latin America and the Caribbean. But the fact that I had worked in Rwanda for the past 10 years, and this really the story of these girls really relates to me. So when Partners in Health established programs in Rwanda in 2005, I met these children at one of the district hospitals we supported in a rural area in Rwanda. I met them in the same circumstances that I found myself, my two sisters and I, some years back in 1988, when our mothers died with cervical cancer in Haiti. I was myself 14 years old, and my younger sister was 5 years old. So having to meet these children that day brought to me, the same image that I had facing with my family, some years back. So these kids at that hospital lost their mothers also with cervical cancer. What I want to say today, that little girl with the flesh on her head was 7 years old when her mother died. And today, she's 18 years old. So my concern is, how are we protecting the new generation of girls in our countries, in our developing countries? My sisters and I, we consider ourselves as lucky because we managed to get it to here, because today I'm 45 years old. I managed to live that long, and we all live in countries, our host countries offer to us the benefit of those health systems. Because today, I can have access to pap smear every 2 years and see how I'm doing. My sisters also, because they have the benefits of living Haiti and be hosted in countries where those health systems are available. My own daughters, I have 2. They also are lucky because they had already received the vaccine to protect them. But in about our girls in our countries, all these countries in the Latin America, Felicia talked about Haiti today, the situation of Haiti today, where our health system is completely broken, where, not all, because Partners in Health work is located mostly in the in the Department du Centre, in the center of the country, but in about the rest. What we need to do today to make sure that all girls, no matter they were living in the north or in the south, have the same access. So the equity agenda should be part of this fight. For girls everywhere they are to have access to these services. So this is why, as Dr. Hannah mentioned this morning, the Sustainable Development Goals has a strong focus on adolescent girls, but around reproductive health, but how we need to integrate cancer prevention in that agenda. I remain to say that prevention and care cannot be dissociated. And we need to have in mind that our girls of today are the women of tomorrow. Thank you.